I think we
So
called.
Sandy said just take the Pepto if it was bothering.
I hadn't taken any Tums.
Right. For the rest of your life, though, you'll want to start
Take
at some
Tums.
point. There's no rush about it. Nothing is urgent, nothing you have to take right now. But over the length of your life, you'll want to take Tums, and it has two powerful advantages. One, it's calcium. And so every one of us in America, we're all at risk of osteoporosis. So a little extra calcium helps.
Okay.
Two, that calcium in your gut helps bind to another funny chemical called oxalate. And you need to know about oxalate because when oxalate in iced tea, in spinach, in chocolate gets in the gut, if it gets absorbed, it can't be used and it gets peed out in your urine. So far, so good. When urine contains a lot of oxalate plus some calcium, it can form calcium oxalate kidney stones. And you don't want that. So you don't want calcium and oxalate in your urine. But, in an interesting paradox, you do want calcium plus oxalate in the gut. Because if you bind the calcium to the oxalate in your gut, it won't be absorbed into the bloodstream and won't have to get peed out in your urine. So let's do this again. It's kind of complicated. By taking oral calcium, it binds oxalate in the gut, and the oxalate in the gut doesn't get absorbed, so it doesn't go to the blood and doesn't go to the urine, and it decreases your risk of kidney stones.
Wow.
So you remember there's a poem or something like that where this is the house that Jack the Rat, that gives this is the house that Jack built. Well, this is the same kind of thing. So that the Tums, not today, not urgently, but for the rest of your life, some Tums 4 times a day is a good thing. Not a lot of Tums, but four times a day, a little bit of Tums will help you because number one, it will some of the calcium in the Tums will be absorbed and help you build your bones. Ding. 2, the calcium in the Tums binds to the oxalate, which keeps the oxalate from being absorbed from the gut and getting into the urine, to go in the urine to form a stone, the house that Jack built. Ding, that's 2. Actually, number 3 is Tums is sold and advertised as an antacid. Okay? And remember, what is our biggest, most feared complication of the surgery? Getting an ulcer or gastritis or... Good morning, come in.
Good morning.
And so that is our biggest worry, and Tums helps a little bit with that. So, no rush, but it's a good thing to bring up and a good comment. You don't have to take Tums. You don't have to take it every single dose, every single one, but over the rest of your life, for osteoporosis, for protection from kidney stones, and as an antacid, some little bit of Tums for the rest of your life is a good thing. Can I do that one more time about the oxalate stones? All right. Almost 10% of Americans are going to have kidney stones at some point. I have had kidney stones. Trish has had kidney stones. Anybody else had kidney stones? How bad? Yeah, that's really bad. You don't want kidney stones. So kidney stones are very common in America. The most common kind of kidney stones is something called a calcium oxalate stone. And that's where you mix